Only serve pros. They stock the top-rated brands you need, offer curbside loading, and can even deliver right to the job site. Service like that is why Lowe's is the new home for pros.
7:07. Team Hochberg Traffic Center time and Jim Talamonte.
In northwest Indiana, we are seeing roadwork delays on 8094 westbound. Traffic is stop and go from Ripley to Clay Street. On the inbound side of the Kennedy Expressway, it's 20 minutes O'Hare to downtown. Outbound 21, there is a crash just past the Hubbard Tunnel, blocking the right shoulder. Inbound Eisenhower, you've got a 2-minute delay from Manheim to First Avenue. Northbound I-55 is heavy. Lorenzo Road to Blodgett due to road work. And inbound Stevenson delays start at Harlem, looking at 40 minutes, 355 to Lakeshore Drive. Inbound Ryan, the travel time from 95th to downtown is now 20 minutes. Inbound Bishop Ford, 24 minutes, 8094 to the merge. That's traffic. I'm Jim Talamonte on AM 560, The Answer.
Worried about basement flooding? Time to call Permaseal, 800-421-SCAL. Chicago's Morning Answer continues next. Your official Chicagoland weather forecast from our 1-hour heating and air conditioning weather center. Plenty of sunshine today. High 87, clear and 63 overnight. Your next news at 7:30. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560, The Answer.
Top of the morning, Dan and Amy. So the D.C. press corps is still committed to its narrative on COVID-19 and doing the best they can to whip people or to continue to keep people in a state of frenzy and pandemonium the way they're covering the case numbers in states that were first to really begin their reopening. Mike Pence had an op-ed in the Wall Street Journal. There isn't a coronavirus, quote-unquote, second wave, at least not at present. While talk of an increase in cases dominates cable news coverage, more than half the states are actually seeing cases decline or remain stable. Every state, territory, and major metropolitan area, with the exception of 3, have positive test rates under 10%.
You know what our test rate is now? 3%. We're one of the states on the decline.
And nationally, less than 6% of Americans tested each week are found to have the virus. Cases have stabilized over the past 2 weeks, with daily average case rate across the U.S. dropping to 20,000, down from 30,000 in April and 25,000 in May. In the past 5 days, deaths are down to fewer than 750 a day, a dramatic decline from 2,500 a day a few weeks ago, and a far cry from the 5,000 a day that some were predicting. That's Mike Pence. Dr. John Ioannidis, who is the Stanford epidemiologist, he gave an interview to Michael Smerconish on CNN recently. He's the one who was seen as one of the leading scientists in the world right up until a couple of months ago, when he disputed the models that predicted end times, that predicted millions of deaths as based on junk assumptions. And Ioannidis was correct. And here's what he says about the state of things, looking at what the real world is telling us and why the lockdowns need to end.
For the average person being infected, the risk of having severe disease and the risk of dying is much lower than we thought. So it is a common and mild infection. At the same time, it can be a devastating infection. There's no doubt about this. But by now, we have learned where exactly it hits and where it can be devastating. It can be devastating when it hits nursing homes. It can be devastating when it hits hospitals, infects personnel, physician staff, and then we have hospitalized patients getting infected. We see that paradox in many people, for example, in children and in young adults. It is less severe than the common flu. In middle-aged people, it's about the same. In nursing homes and in hospitals that get infected massively, it can be a disaster. So we can use that knowledge to try to navigate into that spectrum, try the settings and the individuals who are at highest risk, at the same time probably have some optimism about the prospects of reopening our society before we get many adverse consequences by prolonged lockdown measures.
Mm-hmm.
And there should be, I mean, yesterday they have this new treatment that's offering new hope. It's called dexamethasone. And basically it's a steroid, but it's cut 20% of patients it's helped that were on oxygen. 35% of the patients who are on ventilators recovered once they injected this into their system. But again, it's a steroid, and that's their new hope right now.
They found no benefit, the Oxford researchers, from the drug in patients who did not need respiratory support, but those are the milder cases, clearly. So if you have a effective therapeutic for the most severe cases, those who need oxygen or a vent, then you're talking about reducing the case fatality rate substantially, which should be even more incentive to reopen more quickly. And I on my program yesterday, my syndicated program last night, I spoke with Dr. Thomas Yadiger, who's a pulmonologist and medical director of the intensive care unit at Providence Cedars-Sinai Tarzana Medical Center in L.A. And he said this about the promise of dexamethasone.
Yes, it's obviously very exciting news. I think that still the devil's in the detail, but dexamethasone is an immunosuppressive medication. It's actually a very, very strong one. In a subset of patients, we were already using different types. We were using hydrocortisone for patients that had problems with their blood pressure, and we're also using solumedrol as part of a well-established trial for acute lung injury. But dexamethasone is much, much stronger than those medications. And, if the data is proven to be true, then this would be, revolutionary and can obviously help a lot of people.
Revolutionary.
I mean, 35% of the people on ventilators were saved because of this. And NBC News interviewed a 72-year-old man, and his family said, they told us he has hours to live. And then they injected him with this or gave him this. And he miraculously, within a day, he was off a ventilator.
Well, you heard the doctor call it potentially revolutionary if the science checks out. For
Yeah.
more on this, we're pleased to be joined by Phil Kerpen. He's the president of American Commitment, chairman of the Internet Freedom Coalition as well. And he recently testified on COVID-19, particularly as it pertains to nursing homes and some of what Dr. Ioannidis was talking about before a House Select Subcommittee on Coronavirus. Phil, thanks for joining us again. Appreciate it.
Hey, great to be with you.
Good to be with you. And give us the top line of the testimony that you provided to that House Select Subcommittee.
Well, what I basically did is I walked through a lot of what you just said, the highly age-stratified risk that, this doesn't look like the classic U-shaped age stratification of the flu. We have a J-shaped age stratification, virtually no deaths at all among the very young, little in the middle age, and then a very steep rise when we get to old age. And in particular in the U.S. now, the age stratification for COVID-19 deaths has 60% of the deaths above age 75 and 80% of the deaths above age 65, and they're heavily concentrated in the nursing homes. And we don't have complete data, so this number will continue to rise, but the most recent data we have has about 55% of all COVID-19 deaths outside the state of New York in residents of long-term care facilities. And the reason I say outside the state of New York is New York will not give us a real number. New York deliberately underreports. They report a fake number of about 6,300, but they have a giant footnote on it, an asterisk that says we only count deaths that occurred physically inside the long-term care facility, which is probably a fraction of the total deaths of long-term care residents, because in most circumstances, someone is very sick, they'll call 911 at the nursing home, they'll go to the hospital, and they're more likely to die at the hospital than in the nursing home itself. And if you look at the data outside New York, we have 55% of the deaths among long-term care residents, but only 26% of the deaths occurred physically inside the long-term care facility. So more than half were at the hospital. So it's very unlikely in our judgment that New York is different than that, which means their real number is probably at least double what they report. And it could be triple what they report, in which case the national number would be 60% of the deaths in long-term care facility residents. So we really need a real number from New York to understand the full size and scope of this thing and the extent to which it's really in the nursing homes where the real risk is. But we do know that more than half of the deaths are there, and that's very significant because if the numbers were reported on that basis regularly, then the perceived risk in the rest of the population would be much lower, and we would be putting more resources into protecting the people who are most vulnerable, because we've largely done the opposite to this point. And, of course, you've seen in Illinois, you only get these weekly reports on Fridays, but every week the percentage that's in the nursing homes goes up as they get more complete data, and I think you're at about 55% now, so you're around the national average. But that'll, last week it was 80% in the weekly. So you're seeing something very similar to the rest of the country there. And of course, Illinois is one of the 7 states that I pointed out to Congress that has or had this disastrous policy of immediately, as soon as patients in hospitals are clinically stable, returning them to nursing homes, even though they're still infectious. And it's really been the states that have that policy that have had the very large death numbers.
Well, do you know how many patients that were sick with COVID-19 were sent back to the nursing homes in Illinois?
I don't have that number. If you do, I would love to have it. I know in New York it was over 4,000. There was an AP investigation, but no states are doing that number. So unless you have a reporter who digs into it and finds it and compiles it, we tend not to have that number.
Yeah, and then since they're such fans of contact tracing, at least using that to sound scientific or science-driven, how about contact tracing all those infected individuals they sent back into nursing homes? That would be illustrative as well.
Yeah, well, I mean, you figure, the 7 states that have had this policy, and most of them no longer do, but, sometimes it's hard to tell. And I don't know exactly how Illinois is now handling post-acute care, if they're still sending them back into the nursing homes or if they have designated facilities or have improved this in some way. But, the 7 states that either have or have had this policy, New York, New Jersey, Pennsylvania, Connecticut, Massachusetts, Illinois, and Michigan, they account for more than 60% of all the COVID-19 deaths in the country and more than 60% of the deaths in nursing homes. And so the high-volume states that have really driven the national epidemic all have had this policy of sending infectious patients into the buildings with the most vulnerable people, which is just an insane policy. And yet they do this the same time they lock down the general population, close schools, tell young people they can't go to work, and they justify all of that by saying you've got to do it to protect grandma. But they're sending infectious people into grandma's nursing home.
I know.
It's insane.
Well, do you think there's that we might be over-reporting the number of deaths? And I say that because our public health director, she had said that, yes, if somebody dies from cancer and then post-mortem they test positive, that's a COVID death. That's not a pancreatic cancer death.
Yeah, well, I do worry about this. I mean, the CDC definition is deeply flawed because they essentially say, look, put COVID-19 on the death certificate if you have a positive test, no matter what the actual medical cause of death was. And some medical examiners have refused to do that, and we've had some controversies in states like Colorado where medical examiners refused to do it, and the State Department of Health altered the death certificate to comply with the CDC definition. But Illinois is just basically saying we're okay with the CDC definition. We're going to put it on everything, and they've explained, if there's a positive test, it goes on the death certificate. And, when you're in sort of the very beginning of an epidemic, that kind of makes sense, right? If people are all dropping dead all of a sudden because a new disease has occurred, you're trying to keep up with the record keeping as fast as possible. You say if there's a positive test, we're going to put it in the count. But as we get into this, months into this, the definition becomes a real major problem, especially with respect to the nursing homes, because the median stay in a nursing home prior to death in this country is only 5 months. And so if this goes through a nursing home and it kills some significant percentage of people, but 90% of the people get it and they have a mild or asymptomatic infection and it's gone, but they can still test positive, then you have this problem where over time those people are all going to die of natural causes or of other illnesses. And if they still happen to test positive, because a lot of people still have the viral DNA in them, for viral RNA rather, in them for a long time, and so they can still test positive for a long time, then you can get a very inaccurate count, and it can be dramatically inflated over time. So I do worry that if we don't fix this definition, the count can keep rising even if the disease isn't really here anymore.
Well, and then, of course, thinking about this prospectively, I mean, based on, if that Oxford therapeutic turns out to be as effective as advertised, it just doesn't seem like there's any scientific basis for these continued lockdown policies or the slow walk to reopen in states like New York, New Jersey, Illinois. Here we go again, Michigan, naming the same states that are the problem states.
The states that have had it bad are actually the ones that should be the most open, because it means almost the whole population that's going to get sick probably already has. And you see that in the positivity numbers in the states that were really bad. They're now the least positive. So it's sort of it's farthest along. They're sort of past the whole epidemic curve. And so rather than being the most cautious, they should probably be the most aggressive in opening. But the interesting thing to me about these steroid studies, and this is the second one, this is the second steroid study that's been very, very promising, this dexamethasone study out of the UK. There was one out of Spain last month for methylprednisolone, or Medrol, which is a very commonly used systemic steroid, and was similarly effective. I think they found it was like 40% effective in preventing death in severe cases, and I think dexamethasone they found something like 33. The WHO, going back to March, told doctors all over the world, do not use steroids. The normal treatment for a viral pneumonia includes steroids, and yet the World Health Organization was adamant that doctors not use steroids for this. And here we are 3 months later, and we're getting trials saying that steroids are highly effective. So this is another stunning example of the World Health Organization really putting things on the wrong path.
Yes, I mean, it would be newsworthy if the WHO got anything right.
They're keeping their perfect record intact. They're being wrong on everything.
Phil Kerpen, president of the American Commitment, chairman of the Internet Freedom Coalition. Phil, thanks for joining us. Appreciate it.
All right, have a good one.
Thank you. And he joined us on our turnkey.pro answer line.
Connect with Dan and Amy using the AM 560 mobile app. Download it today at 5